Locked down in shared flats and halls of residence, away from their families at Christmas. That won't be happening to students this year, according to the government, which has promised to get them home thanks to a rapid testing plan to travel. The scheme will be rolled out across campuses, including here in the southwest, during the last week of this 4-week lockdown, by which time the government says the risk of infection will be far lower. Scott Bingham reports.
The University of Exeter was one of a number of seats of learning around the country which saw a big rise in coronavirus cases when students returned in September. At one point, the city was in the top 10 highest infection rates in England. Measures including spit testing have seen the number of cases fall dramatically, and today universities across the southwest have been examining guidance from the government aimed at getting those students safely back home for the festive break. There are 1.2 million students across England. The plan is to offer them mass testing with rapid results, and for those clear of coronavirus to stagger their journeys home in a week-long window between the 3rd and the 9th of December, thus avoiding a mass exodus in the run-up to Christmas. Those that do test positive will be expected to isolate before travelling and should still be home in time for Christmas. But the government says the testing will not be mandatory.
Our target will be for those universities that have had higher infection rates or in areas that have higher R rates, also that have higher percentage of more vulnerable students, such as BAME. But fundamental to this plan is the fact that the 4 weeks of national restrictions mean that the risk that these students pose is now much, much reduced.
Most students we spoke to were happy to be tested.
I want to be able to go home feeling safe and being able to see my family and not have the risk of, transferring anything to them, especially my older relatives.
I will probably just stay with friends somewhere around the UK. And if the university is willing to provide free testing, I definitely would take it just for the safety of my friends and the people that I would see.
South West universities say the guidance presents a number of practical challenges, but they'll be working with students, staff, public health teams and local authorities to ensure safe travel so everyone can enjoy Christmas wherever they choose to be. Scott Bingham, BBC Spotlight.
Well, Dr Bharat Pankhania is a senior clinical lecturer from the University of Exeter Medical School. He joins us now. Do you think that this will work?
It may work. There are a number of provisos that we also need to be careful about. So I was listening to your report, and students are very happy to be tested. My concerns are a negative test today does not mean it is negative forever. So if a student were to go home to an elderly parent or somebody who is vulnerable in the home, they need to be extra careful in case along the road, a few days down the road, they go on to become positive. Furthermore, the test is never 100% accurate. Therefore, again, it is important to know that you don't ignore your signs and symptoms of an infection, even if your test was negative.
And of course, it's not mandatory. So I'm just wondering, should it be made a condition to travel? Because some students might feel, why should I risk having a negative test and therefore have to isolate, may just want to travel anyway?
Yes, so you mean to say, why risk having a positive test and then have Christmas cancelled? I totally agree with you. It is not mandatory, but we also don't know what statute government is using for test, and then we allow you to go home in this window. So a lot of uncertainties. My view is you need to consider this test carefully. Just because you're tested negative today does not mean you're negative when you go home, and you need to remain aware of signs and symptoms and take all necessary precautions when you go home.
If you were to devise a plan to get students home for Christmas, would it be far different from this one?
It is a difficult situation, and I understand people need to get home for Christmas. But one of my options also is to say, keep Christmas a low-profile event. Because if you are coming home to a vulnerable parent, this is the bit that I'm very concerned about. If there is a vulnerable parent or somebody in the family, you need to think of plan B. That's what I would be adding. And one more thing, Victoria, if I may add, I would be saying, look, please be careful when you go home over Christmas, because you may change from being negative to positive, i.e. a proper case, or your test result was falsely negative. So again, be aware.
Dr Bharat Pankhania, thank you as ever.